Welcome to Surviving Society Presents, the Black Health and Humanities Network podcast. These episodes focus on the politics of black health in modern society.
Hello everyone, I'm really excited today to be joined in the studio with Rianna Raymond-Williams, who is a writer and researcher and currently is doing a PhD at Glasgow Caledonian University of London. Rianna is also the founder of Shine Aloud UK, which is an organisation, a social enterprise that supports young people navigating sexual health and relationships. It's a really exciting day for me to have Rianna in this studio because I've known Rianna for a number of years now and I've always been so inspired by her work and energy, positivity, and just like someone, a black woman that I know that just gets shit done. You just get shit done, and like it's like you meet people like you in your life and you're like, actually no, I do need to do that thing, I need to make that thing happen. And you're that's what your presence does, and it's really amazing to know someone like you, Rianna. So thank you so much for coming to the studio today.
Well, thank you so much for having me. I'm really honoured to be a part of this conversation, and I think it's really inspiring to see you as living proof, Chantel, by kind of completing your PhD. You've always been so supportive to me on that journey. So yeah, thank you for having this conversation. I'm looking forward to what we uncover.
So listeners would have heard intermittently, and they'll see in the episode notes, that your work focuses on basically democratising sexual health and contraception advice for black and ethnic minority people and other populations more broadly. Is that right?
Yes, right. Yeah.
So I guess it would be good to sort of talk about how you got into this work.
Mm-hmm. So I guess there's a few points of entry, but I think for this conversation, the most important one was that I'll start with a best friend of mine was actually in a very toxic relationship when we was really young. And as a result of that, she needed to access support and care. So I kind of supported her to attend this service, and they referred us to another service that provided like a kind of like support group, an informal support group for young people in the area. And that's where I met some amazing youth workers who talked to me about sex and relationships, and we had an opportunity to design leaflets, run events, do sessions with young people. And I guess at the time, the friend I was supporting didn't see the value of the information she was accessing, but also I guess when you're in a relationship so young, you don't understand the harm and the harm that's having to you and kind of how it's impacting you as a person. So I guess, you know, the pull to be in the relationship was much stronger than being the pull to be in the group. So I stayed in the group, I met some amazing people, did some amazing work, and I guess it inspired me from a young age to see that there are solutions that we can create and co-create with young people to address these issues such as, I guess, domestic violence, unhealthy relationships, access to adequate care when it comes to sex and sexual health. And I guess from that point, I was really inspired and thought about what could I create or contribute to this space. And I guess alongside that, I had an interest in journalism and thought about how could I combine the knowledge I was receiving with arts and culture and journalism to create something that would be useful to people in the community, particularly black people at the time, because I'm a black person. And I guess it's kind of just grown since then. So kind of being a young person volunteering in a space, becoming a youth educator, then working on National Chlamydia Screening Programme, which was collecting or advising young people to access chlamydia and gonorrhea testing through outreach service. So we would go to colleges, universities, youth clubs, libraries, pubs and clubs, and test young people for chlamydia and gonorrhea. And that was like their first point of call to access sexual health. So we would do the testing with them, and whatever the results were, they would go on to a service in a local area and do follow-up treatment and care. But I guess it just inspired me to think about other ways that we could provide care to people. And I guess fast forward now to my journey where I'm doing my PhD, I'm particularly interested in looking at how Black Caribbean women access sexual and reproductive health care. And I guess in a way, reflecting on my own journey, being a service user, service provider working in sexual health, and then now in a kind of stakeholder policy influencing space, and thinking about how can we change the way that things are done in order to meet the people's needs who need the care the most.
I'm going to give Rianna a slightly mic drop for that. We haven't had one in a while, but that's fully a mic drop moment, Rianna. I want to just roll back to your introduction into this work, and it's such a familiar set of circumstances. You recall like being best friends with someone and seeing that they're in a relationship that is abusive and wanting to help them. And what is so beautiful that has obviously came out of this is that you were able to guide that friend and then meet other people that were actually looking to help create services to support people like your friend. Like, everyone has that friend.
Exactly.
And it's like, to know that you were so you had so much resource in your spirit to think, okay, right, where can we find help and support? And then you found this network, and then it's now become your lifelong work.
Right, exactly.
It's incredible.
Yeah. Thank you. It's really interesting you say that, because I think sometimes you're right. It's a very familiar story. You know, these stories of, I guess, how young people are impacted by the range of issues that are around them. But I guess something that kind of rings clear to me in that picture was that we didn't really talk to adults about what was going on, particularly adults who could support us and would be available to us, because I think sometimes of the secrecy that exists in Black communities, and secrecy in terms of like the shame and like maybe the uncomfortability of having these conversations about young people having sex. And I think to kind of tie that in with my research, I'm kind of identifying secrecy or shame as like a heavy emotion that people are carrying. So people have gone through particular experiences or made choices and decisions, but they felt they couldn't come to their families and talk about it because their families haven't provided the space to kind of explore the topic or have the conversation, because they didn't have it in their generation before. So it's like an ongoing cycle of silence where nobody's talking about what's actually happening, and we're continuing to make decisions or choices in an unsupported way. And I guess a lot of my career was talking to young people about how to be assertive, informed, and make the right choices. But I recognise I should be talking to adults about having those conversations with the young people to ensure that they feel confident and comfortable. And if they don't, find people who do. Because I guess we're young people, we're children, and children should have the supportive networks around them to help them make the choices and journey on into adulthood.
That's so powerful, Rianna. And just to say as well, I sort of said we've all had that friend, but I'll just speak for myself. I've also been that person as well. And it's kind of like what your work does is it does really tap into that, how complicated shame, personal experience, lived experience, voicing these things, how complicated it is. But like the fact that you're creating space in your work to name these things is so transformative.
Thank you. I don't think I've really sat with the reality of it, because sometimes it feels like you're doing and responding. And I think in my previous roles, I found I've just been responding to things. People got an issue, okay, how can we fix it? What do you need to follow to ensure this person is safe? Like, that's important. But I guess this doesn't really allow you to think about all the other possibilities. Instead of just being responsive, how could we be more prepared to ensure that whatever issue or challenge a person comes with, there is a series of options that we can choose to support them. Instead of just being quite responsive, and it's like you're always putting out a fire instead of preparing for the fire to happen in advance.
It is proper transformative work, and it's so essential. Why do you think it is that we don't have these conversations?
I guess thinking about...
Or sometimes don't have these conversations, so I don't want to be deterministic.
Yeah, exactly. Because I think people are having conversations, which is important in some family spaces and communities. People are having conversations, and that's important to acknowledge, you're right. Yeah. But I think it comes with the vulnerability. And I guess when we speak about, if you're an adult and you're speaking to a younger person about choices and options and decisions, I think you probably have to give a bit of yourself in that conversation.
Right.
And that can be uncomfortable, particularly if you've made choices that you're not happy with, or, you know, have gone left in a particular way. It's not shameful, it just is. And it's the reality of life. You know, people
I love that. It just is.
It just is, yeah. And it's not anything we should be ashamed of or like hide away from, and kind of hold parts of our life to keep it secret because it's shameful and we're going to be embarrassed if somebody knows, or, you know, just the kind of threat of somebody knowing something about you that you didn't... I don't know. I just think sometimes there's a heaviness, and it kind of grows and grows and grows into this big mountain that you don't even know how to kind of get to the top of anymore. It just becomes so bigger than you.
Definitely. And that's why having people like you doing this work to kind of ease people down from that mountain and say, look, it's okay. It's okay to just say the thing. Because you are a human being.
Exactly.
And also you're a human being that exists within structures of society which have implicated and affected the decisions and choices that you make.
Absolutely.
What would you say some of the standout things that you found from your research so far?
People want a space to talk.
Yeah.
And I guess I think more and more about that. People talk about communities being hard to reach, and I just say they're easy to ignore. I also have to recognise who I am in this study. I'm a Black woman. I'm a Black Caribbean woman. So in a way, people feel a bit more connected to speaking to me or want to speak to me in comparison to sort of another person speaking to them about, you know, their life and their experiences. And I think that's really important. Sometimes it's not the right people doing the work, and too often there's a narrative, oh, people are hard to reach. Well, get the right person in and they're not hard to reach, you know. I guess also thinking about this community, like people talk about sisterhood circles and spaces. And I guess sometimes I've had conversations with women who feel like they haven't had the best experiences with Black women or in Black spaces, and they felt they're not the right type of Black person. And I think we need to destroy this narrative of like the homogenous idea of what Black is and what Black means and what it represents. It's just a variation of Blackness. And I think we need to kind of, support each other on our journey of understanding who we are in this world of oppressions and dominance and problems. And just kind of support and be a bit more encouraging and together with people and understand their journey a bit more instead of judging and making people feel, I guess, just othered in multiple ways.
That's so powerful, Rianna. I just want to roll back to, but also I think it will definitely intertwine within the research you've been doing for your PhD, but the work you do with Shine Aloud and this kind of contemporary moment in terms of how we talk about sexual health and relationships with young people during a time of like accessible information. What are you seeing in terms of trends amongst younger generations and sexual health and relationships?
So I guess I started the magazine to be a resource, and that was back in 2011. And I guess it's a physical publication as well as an online publication, but I guess quite text heavy because I like to write. I still like to write.
You're a brilliant writer.
Oh, thank you. But I'm recognising people like to be a bit more interactive with the content they consume. So thinking a bit more about videos and podcasts and animation and photography, and thinking about all the other visual mediums we could use to give information. So I see online there's various influencers who do videos, and that's really successful because I think people want information very quickly.
Yes.
But also where they can see real people and kind of engage in a way that's relatable to them.
Yes.
So I think there's like a trend towards visual content which features people who are relatable, that are quite short in time. And in a way combines arts and culture because we still have to be relevant to the times and the things that people are engaging with. Not just reading something very medical in a video that might not land with people, but having like even maybe thinking about the influencers themselves, like bringing them into the conversation to represent the stories or conversations that needed to be had.
Amazing. And I guess, what about our young people's sexual health and relationships? What are we seeing conversations changing, moving forwards?
In some ways, I think so. But I think thinking about like my career journey, there's something about like preventing risk. And that was the risk of being in an abusive or volatile relationship, not just intimately, but in friendship circles, preventing pregnancy, preventing STIs. So very much from a point of like preventing people from being at risk.
Yes.
Instead of like, I think in supporting people to develop skills that allow them to make choices. Because I think, again, it's very responsive. It's very responsive and very important to be responsive. But I think there's a need to have like other types of care and services that speak to like building a person, building their skills, building their qualities, understanding their interests and behaviours and attitudes and values. All of that's really important. And I think sometimes the preventative work can go in like very like domineering, like don't do this because this will happen, which can be quite frightening, you know. And I think we need to provide space for people to bring stuff that they want to talk about to the conversation, which I think is important.
I worry that like making mistakes, like the punitive measures of how we exist as social beings now, like I feel like for young people, as they're feeling the sharper end of it, like maybe than we ever did, because of how online we all are now.
Yeah, and it's worrying. I feel like you're right about the mistakes. Like people feel like they can't make mistakes. And more so now, because if you make a mistake, it might live online and people are going to see you and it's going to go global and viral, and there's like a huge pressure to be perfect. And I guess in my time, we just had MSN and there wasn't any there wasn't any Instagram and TikTok. And like, if you did something, it was kind of like in your locality, people would be aware of it. But now I guess there's like a big embarrassment factor that people feel quite shameful about and feel like they can't make a mistake. They have to kind of show elements of perfection in their timeline all the time.
And I guess just circling back to something that you said earlier, our way to mitigate these feelings for young people is by being honest and open and vulnerable about our lives and decisions that we've made.
Yeah. It's really interesting because I think just as you were saying that, something came to mind that I think about often, which is like the blurring the lines of the public and private.
Yeah.
So as much as I'm saying public, yes, I think there's things that need to be shared out in the open, but I also think that we need to reserve a space for things to happen in private, because that's important. Not everything needs to be online. And I think right now people are really blurring the lines between
big time.
Yeah, like there's things that we just shouldn't be hearing or shouldn't be known because you should be talking to your brethren in the corner about it. Yeah. And that's fine. Like you have that private conversation with them and not with us. And I think that's because people want to consume everything of everyone now. There's not a break and there's not a distinction between almost like like the privacy. I think I may be being contradictory. But
no, not at all. I think that these are all multiple truths that I think at the moment we are in a kind of, there's so many different emergencies happening within our private and public lives. And I think talking about these things or how we relate to each other is crucial because at the moment it's all a bit topsy-turvy, isn't it? And it's multi-generational. Like we've got people that we could maybe argue between the two of us should maybe know better in terms of what they're sharing, in terms of the life experience they've had, but actually like maybe not. Like it's multi-generational.
Yeah, exactly.
Yeah. So I think that whether it's within your community or outside of, do you feel that people, when they approach your work, they're nervous about it?
I think initially in the early beginnings of my career, like when I was doing outreach and I would go to colleges or schools or like youth clubs or anywhere, and I would speak with older people. Yeah. They would get quite defensive and say like, why are you teaching young people to have sex? And I said, I'm not doing that. We're having a conversation about what relationships are, what sex is, why people are having sex, how to access care if you need it. Letting people know that care is free as well, because I think people don't know that you can access sexual reproductive health care for free.
Just reading one of your articles again this morning, like just to say to listeners, contraception is free in the UK.
Yeah, a lot of people don't know that. I mean,
I knew it, but almost didn't know it. Sometimes just we don't talk.
Yeah, exactly. So, yeah, I think people don't know what they don't know.
Yes.
And I feel like because they don't know what they don't know, their first response to it is like, oh, we shouldn't be doing this, like shut it down. But I guess as you invite people along the journey with you and start having the conversation, they maybe realise the benefits of the work. And like, it's not just work for me or for that young person, it's for all of us. It's for the community to feel more empowered, feel more together and feel more resourced. Just try to feel like we have a bit more control and agency. Yeah.
It's really interesting you say that, because just you've given a kind of anecdote of fielding those conversations with elders, perhaps saying, why are you teaching young people to do this? Like, you taking people on that journey is such a service to the community, and your work is in service to community. This is a lot. It's a lot for one person.
It is. Yeah, I guess there is a heaviness to it. There's a heaviness and maybe a responsibility that you feel. And I guess I have to kind of acknowledge that the start of this work and where I am now comes from responding to a need. There's always going to be a need for care and adequate services and information. But I guess in recent years, I've started to feel like, should I continue doing this work? Because what impact is it having on me and my health and well-being? Can I just like paint and draw and like create stuff that is a bit less heavy? And I think it's a real conversation to be had. Like, how long can you continue doing work that is burdensome in some ways. As much as it's important, it also takes its toll on your emotional well-being and your relationships, and kind of impacts you in ways that you don't imagine it to, because you're thinking about fighting the good fight and being a resource to people. But yeah, it's a real reality. Yeah.
I think the reality is that we do get to a point where we can't do the work in the same way anymore, but that's the point where we hand over to the next generation, isn't it?
Exactly.
And like, I guess part of our work now is continuing to democratize information, care and support, but also preparing
the next generation to be able to carry it forward. You know, you're right. And I think what you said about passing on is really important. And yeah, I think we need to do a bit more of that, pass on, so we allow ourselves to grow and do different things in our lifetime.
Yeah, definitely. Because it is like, the thing about your work that's so powerful is it's a universalized topic, but it's one that within certain cultures and communities people have a lot of opinions about, and you have to field that. You have to be at the forefront of like democratizing care and support, but also fielding people's at times probably like challenging commentaries on the work you're doing. Like it's such a multifaceted role that you have.
Yeah.
Big time. So what is, after the PhD, what is the plan? What do you want to do with this research?
So I guess I've always been interested in like visual content and thinking about how do you create content that's more accessible. I guess maybe part of that is my dyslexia and thinking about how I engage in information. So thinking about like, how do we create a film, a podcast, an animation, photography? How do we kind of humanize the people's stories I've been talking about? Because I guess sometimes on the academic journey for some people, it's a bit extractive.
Yeah.
You go, you do a data collection, you write your study up and you go about your business.
I remember when you were first applying to do a PhD and you said to me, Chantel, like, you were saying, I don't want to do it in a traditional way because I want my work to be accessible to my people. And so much, that was something that you was really, and I was like, no, you can do both.
Exactly.
But it's hard though, because
people don't tell you that. People don't tell you that because I feel like there's meant to be this way of studying and this way of producing and this way of being academic, which isn't true.
No.
And I think a lot of my work has been spent in community and being in places with people. And I think sometimes academic community is very detached from community spaces and people.
Big time.
So it's just, it's different values and different people that exist in spaces like that. I think long term, my plan is to do more traveling and looking at how I can create spaces for people to travel and share and learn from each other. So an experience or like an example of that was like a year ago, I was in Jamaica. And had the opportunity to go to University of West Indies.
Hey,
and it was a chance for me to understand how, I guess, care was provided in that context. So I think there's a perception that if you're in the UK or Canada and America, you've got the best of everything. And I think it's not the best, it's just different. And I think we need to understand those differences and similarities. The same things that may exist in Jamaica that exist here, but we're not having the conversation because this hierarchy of knowledge production, you know?
Yes, come on. Someone's in a epistemology bag. Right? Come on, I love this. But I guess... So the next step is international solidarity building around sexual health and contraception.
Not just sexual health, I think just public health.
Public
as well.
health,
and particularly young people. I think we talk a lot about young people not leaving their local area, but as long as people haven't left the country, and what would that mean for young people to meet other people? Who have similar experiences to them because of all the oppressions that we know exist in the world. And to have that conversation and build that dialogue and expand their network, I think is so important. And I guess for me, I started engaging with Erasmus, I guess as an older person, because I think a lot of people do Erasmus when they're in college or university, they do like a gap year abroad. But I started engaging in Erasmus programs, I think when I was in university, like doing my masters. And it was a chance for me as a youth worker to go over and understand different practices. I met people from Poland, from Bulgaria, from the Netherlands, from Italy, like just different types of people. And I think we don't always think about I guess the differences in our practice and what we can learn and share with each other, because it's too busy talking about what is the best. And I don't think having this best narratives is helpful to anyone.
You know what's so powerful about your work, Rianna, is that you are a very, very good orator and you're very good at consuming information and redistributing in a way that's accessible.
Thank you.
And that is such a skill, and you don't get many people that are able to do that, particularly in academic scholarship as well. So I know for a fact that what you say you're going to do is going to happen.
Thank you.
Because not only because circling back is something you get shit done, but also to be able to communicate visions, ideas, but also be representative of varying parts of communities. Not many people can do that.
Thank you.
And you are a gift, not just to Black people, but more broadly on a global scale as well. And that is your work, isn't it?
I really appreciate that. I really, really do, because I feel like sometimes you just do what you do. You don't really recognise it. You're just doing it because you're doing it, you know?
No, it's always been clear to me how special you are, but seeing you now go through this next period of scholarship, but communicating your scholarship outside of the academy, it's very clear to me what you're going to be, and that's a beacon for so many of us. Continue to be a beacon. Yeah.
Thank you.
Thank you so much for joining us, Rianna.
Thank you for having me.
Thank you for listening to Surviving Society.
To support our work, you can rate,
review and subscribe. To host or produce a series of Surviving Society,
get in touch with us via Twitter or Instagram.